Good afternoon. I'm going to present the Disease Bioportal project on behalf of my PI, Dr. Andres Perez. We work at the Center for Animal Disease Modeling and Surveillance at UC Davis, and hopefully he will be able to connect at the end for questions, or, well, I will be glad to answer you if I can. And this project may be useful for your own projects because it has a lot of genomic surveillance, so if you find it useful, you can just contact us. So, what is a bioportal? It's a web-based IT system for real-time or near real-time access to local, regional, and global animal disease information and data. So it collects data from different sources, put it in the system, and it's not just the data is not just available there as a data collection, but also for data analysis. The original goal was to create a long-term program for sustainable research, development, maintenance, and operation of global animal disease modeling and surveillance. The project started in 2003. It became operational in 2007, and the last version was released early last year. So it has been in constant improvement, and it has developed new tools for epidemiological surveillance and analysis. And well, you can access it at there in the small white letters at the bottom. You can see fmdbioportal.ucdavis.edu. So, which are the attributes of the Disease Bioportal? It's operational, so you can log in now and create a username and account and start using the free public databases available, or you can submit your own private database that you will have access through secure routing. And it's in constant improvement, and the programmer is working constantly to maintain it operational. It allows for real near-time surveillance because the databases there are constantly updated, and it also you can also subscribe to receive foot and mouth disease news and Rift Valley fever news in real near-time email as daily emails or on a weekly format. The data collected in the bioportal comes from multiple sources, so you have in this one place data collected from other places. And well, it's as I said before, it has analytical capabilities. It's not just meant for data collection, but also for epidemiological analysis. It's in continued development. And it also allows for genomic surveillance, which for peers I think it has been very useful. And it works as a coordinated consumption, so it has been funding through different organizations that have found the bioportal useful for their own projects. So it's operational. It has had over 900 users since it became operational in 2007 from 55 countries and organizations. And the version currently operating is the third one. And you can have access to public databases containing information for over 40 animal diseases and syndrome. The public databases that you can find, well, this project was originally designed for FMD, and since the platform was constructed and was useful for other diseases, we expanded the scope, and now more diseases are incorporated in the bioportal. Well, the OIE, you have the OIE weekly and a country incidence report, which are updated constantly. Data from GenBank also, sequences. FMD data is now available, but sequences from other diseases will be available upon request because the platform is already made. Panaftosa and Precise and other national databases that are public. For instance, the Vietnamese Animal Health Department has information on avian influenza and foot and mouth disease. This is an example of a map created in the bioportal, so if you just want to make a background or a presentation with the most updated information, you can create a map in the bioportal and present it. And the private databases, and this is a very important point for the swine industry here, because the data sets are supposed to be private, and So confidentiality is one of the main issues. And the data that you upload, it's not available for the general public, but only people with their own passwords. So the privilege of looking at that particular database are only given to the people that are considering these agreements with UC Davis. For instance, the ARC-NE program that BI is conducting. You can conduct phylogenetic analysis, and I'm going to show a short video afterwards with a phylogenetic spatiotemporal visualizer. This will display a sequence tree as the sampling point is the map of that particular sequence and the time window in which occurs. So it's very useful for molecular epidemiology and to see how the sequence evolves in space and time. And that, of course, to make inference about the likely source of the outbreaks. The video that I'm going to show, it has the last program that we have, the phylogenetic spatiotemporal visualizer, but we are constructing our own program, and it will display, instead of having that plane map, it will display the sequences in Google Earth. And it's estimated to be ready this month. Another tool, epidemiological tool that you have there, aside from being able to display your data, is to make cluster analysis. So you will have an idea of statistical grouping of the disease in space and time, not just visually seeing aggregation, but statistically proving aggregation. And you will need the latitude and longitude of the event in decimal degrees and the date of the event. It used SATScan. I don't know if you are familiar with SATScan. It used space-time permutation, and it will show the SATScan output with all the result, the significant clusters, and the p-value for the significant cluster. And it also will automatically display the circular clusters in Google Earth, which is very useful. You have that a time window in Google Earth that you can manage to see the clusters in space and time. So this is how the login website the page looks, and this is a small demo video, so you access through that login website, and you will search in the different databases. I have there quite a few private databases, but in this case, I will search for a public database, which is the YE Weekly Reports. And you can filter for different criteria. In this case, you're looking for blue tongue in Europe. You can also filter by the day reported, so you can. It will only display data of your particular interest that you're looking for. It will show the data in a grid format, so you can have it there, and you will have the details of the particular report in the bottom window. You also have the access to the original source there from a link that you will see there. It will also, if the outbreak of the event has latitude and longitude data, you will be able to display it in a map, and also you will see you're able to see the details within the map. So it's very useful for display of the outbreaks in space. Now, the other thing you can use is the chart tool, which will show the distribution of your data, for instance, the number of reporting time, or the number of reports per country, or per species, per serotype in this case. Of course, it's most serotype 8 in blue tongue. You can also display the outbreaks in Google Earth, and the good thing about Google Earth is that it will not just display the data as points in the map, but it will display it as dynamic points in the map. So you have that little window at the top left of the screen. And for instance, here you're only seeing that particular point in the map. And if you widen that time window, you will be able to see how the outbreak started to show up in space and time. So that's very useful epidemiologically. or you can just see all the outbreaks there widening the window. You also will see the details of each of the points if you click in there, and what was the source of the report and the serotype. The other thing you can do is you have the data, all your data in a grid format. You can download it in a spreadsheet, so it will download to Excel. Sometimes you need to do analysis in other software, and most of them require them to be in a format in a spreadsheet. So all the data that you filter from will be available in a spreadsheet without having to do any further transformations. And the genetic tools that you have, if you have a database that have genomic, that have sequence information, in this case I'm using FMD data from a project that we're working in now in Pakistan to support FMD control. So you filter there for the disease you want to search for in your private database. You can also search by day. And it's pretty much the same that we did with the last with Bluetooth, but in this case, if the sequences are previously aligned, you can make quickly make a phylogenetic tree. You can give it different shapes, and it will give you a number of options there to transform your tree. And the other tool is the phylogenetic spatial temporal visualizer, which was the one I was telling you about before. And this is a very powerful tool because it will allow you to see the evolution of virus in time, and I think that's very important for peers. For instance, there you have the points of the map of a particular sequence isolated in the map, and you have the time window below, and you have the sequences in the trees up there. So the sequences will appear, which sequence was acting in space and time. And the other thing you can do is you can color the different sequence based on the genetic distance among the sequence that you there. It will color your different sequences if you want to cluster different strains based on the genetic difference. You can do that also and see them there in different colors. Okay, so we've been working with the ARC and E program control, ARC control and ARC, Area Regional Control and Error Elimination peers program. And we have been supporting them with surveillance, visualization of virus sequence in space and time, and the molecular analysis. We could also support with cluster detection or further risk analysis, because sometimes the outbreak, it's not just to see where the outbreaks cluster, but doing risk analysis is seeing where the risk factors might cluster, like management practices, which are in a certain area, or the source of the pigs or of where the animals are purchased. So you can do cluster analysis of that and see where the higher risk areas are. And also accessibility, of course, these have a confidential agreement, so there are different passwords, so different individuals can have access to just certain databases. And this works as a coordinated consortium, so it has been funded by different organizations, and recently BI was added to this number of organizations that fund this project. Dr. Perez wanted me to show you some of the projects we've been working on further in the Center for Animal Disease Modeling and Surveillance. So it's not, we've been working with projects from all over the world: Argentina, Peru, Spain, Israel and Palestine, Turkey, Mongolia, Pakistan, and Iran. And we've been working with different diseases, not just FMD. And this is a project, a study that we did in Argentina with the data that was collected from the Argentina national database from the outbreak that they had in 2001. They were declared free of FMD without vaccination. and they had their whole population susceptible. And some months later, they have this big outbreak, and more than 2,500 herds were infected. So up till now, they are still vaccinating, and they could never reach that status again. So what we did is we estimated the transmission rate within each of those 2,500 herds, and estimated the association of that within herd transmission with epidemiologic factors. And one of the most important findings was that those herds that were vaccinated were had less within herd transmission, which is another evidence supporting FMD vaccination. And I don't know if you are familiar with FMD. There is a lot of supporting evidence of FMD vaccination in case of emergency outbreaks, instead of just culling and depopulating the herds. And this is another project that we've been working in. We are supporting a project to control FMD in Pakistan. This phylogenetic tree was constructed in the Bioportal. And what we're trying to see here is if genetic variation is associated with some epidemiologic factors, specifically space, time, and species. So we are working with FMD serotype A, O, and Asia1, and they behave really different, and they are associated with different risk factors. So that has been very interesting.